Dr. Dan Tomlinson joins us now to answer some of your medical questions. Thank you for being here.
You bet. We've got some good ones today.
Some good questions for Dr. Dan tonight. Now, a viewer wants to know how we can protect ourselves from West Nile virus. The question, are chemical bug repellents bad for you?
Okay. Well, that's a meaty question indeed. You know, the genesis, of course, is because of all the problems down in California and in the nation. There's been 66 deaths from West Nile virus. It's mosquito-borne. Now, in Oregon, there hasn't been any deaths. There's been 2 reported cases. Now, but still, they're mosquito-borne. You know, so to protect yourself, before I get into the question about the repellents, it's morning and evening around water where those mosquitoes are going to come out. So the recommendation is, to use repellents that have DEET in them. Cover yourself with long shirts and long pants. Maybe that's not super practical. But the good news is most people that are infected with West Nile virus don't get sick. It's about 1 in 150 that become ill from West Nile virus, and it's meningitis, which is terrible. The symptoms of meningitis are a bad headache, stiff neck, and a high fever. So since we can't really totally keep ourselves from getting bitten by mosquitoes, but for the most part, nothing's going to happen. If you get sick, and especially if you get a stiff neck, high fever, and headache, you might want to go to the emergency room.
Right, because it's kind of scary, and I know a lot of people just do whatever they can to protect themselves from mosquitoes, and some people get bites more than others.
You bet. Some people are more tasty, if you will, and
I'm one of them.
I suppose it depends on vitamins and your chemical makeup and so forth. But they wanted to know about the repellents, and they are poisonous if they're ingested, but they're not absorbed well through the skin. So it's better than getting mosquito bites.
All right. I think my blood's just sweeter, Dr. Dan.
Sure.
Maybe.
I believe that.
Maybe not. All right, a Facebook friend is trying to get pregnant. She wants to know whether over-the-counter ovulation predictors work.
Yes, they do. If you're ovulating and it picks up the LH surge, the luteinizing hormone surge, that's typically going to be about 12 to 24 hours before the actual ovulation. Sperm will hang around for about 24 to 48, sometimes 72 hours. So relations the day of the surge or the next day will generally do the trick. The problem is that humans aren't that fertile. It's 20% fecundity rate per month. That means the chance of getting pregnant in 1 month is 20%. Unless you're an 18-year-old who doesn't want to get pregnant, then it's near 100%. So the point is, it will pick up ovulation. You still might not get pregnant. And of course, if you have an irregular cycles, you might miss that window because it's not always the mythical 12 to 14 days after the period.
Okay, so they help, but it's not necessarily foolproof, 100% accurate.
They can tell you if you're going to ovulate, but they won't for sure say you'll get pregnant because you can still have everything working right.
Right.
And it just doesn't happen that month.
All right. Thank you, Dr. Dan.
You bet.